healthcare has progressed at great speed and we've had some fantastic advances over time, and I think the reason that's been driven partly is because doctors, but also the broad range of professionals working in healthcare have always strived to deliver better care for patients, and the way to deliver better care for patients is to always try and innovate and improve what you're doing.
I think the next generation of the healthcare workforce coming through really need to have a clear understanding on how to drive innovation within the workplace and to know where to go.
Got a very enthusiastic bunch of trainees, particularly around Oxford and Thames Valley. In fact, someone once described our medical trainees as the jewel in our crown. They have lots of ideas. They're not as cynical as people, myself, who've been around a long time. And I think it's about time we started to harness those ideas and their energy.
So I was doing my medical student placement on neurology and neurosurgery when I had the idea. And then around the hospital, because the challenge was quite well marketed, I saw a lot of posters and things about the challenge. And I thought it would be a good thing to apply for with the idea.
Thank you. Firstly, I really like the idea and like the presentation, and like this old professor, I've been in your shoes many years ago.
The application form made me think about lots of things I hadn't really considered from the medical point of view of the idea. So where the intellectual property would lie, where the market would be, the potential companies to work with. So it's really been a lot of research has gone into areas that I just haven't really been used to at all. And it's been very helpful to have the support from the innovation managers because of that.
So you need to get a lot more patient involvement in terms of getting their feedback, not just what, and I would argue what the consultants think is much less important than what the patients think.
I was reasonably nervous about the presentation and the questions that might come up, but I went through with Chris and we went through, and I was just trying to be clear to just deliver the idea in a way that could be well understood in a reasonable manner.
So we originally saw all the advertising for it, and we thought it would be a fantastic opportunity to use it as a springboard to put forward an idea that we'd all come up with together. We felt that it seemed very professional and like something we would really enjoy doing, and so far we really have.
I mean, at every point since our application, we've been in touch with business case managers, people who can tell us about intellectual property, and the steps involved in bringing it from an idea to an actual physical product. And I think the best bit is the promise of ongoing support. So win or lose, there might not be the financial backing, but there'll be the management side of things on how to take it forward.
So it was nerve-wracking, but I think we've all worked very hard to get to this point, and it was a real honour actually to be able to pitch our idea and something we're so passionate about to a panel of judges who know what they're talking about.
Innovation is fundamentally the lifeblood of the NHS. From the early sort of incarnation, we're facing with less money, more patients. Technological advances and innovations are going to be key to the long-term success and survival of the NHS.
Can you tell me a bit more about what your understanding of the problem to which this is a solution?
It's been very nice to have someone who's not a clinician but from this background to help us. I would just encourage everybody to do it because it shows you that you can make a change and there are people who are interested, and I think as junior doctors we do lose that perspective. Investing into people who can make that change, who have the enthusiasm and the thoughts and are happy to invest their time to do it is just, what more could you want?
People like Angus and I have ideas, but we don't necessarily get the opportunity to develop those ideas. We grumble about it over a coffee, we moan about it to our partners on the way home, but this has given us an opportunity to do something about it.
We weren't entirely sure what to expect. It's been really well organised because we sort of deal with emergencies and sick children, and that's fine. But this has all been quite new and terrifying and very exciting. I thoroughly enjoyed it. I think we need many more initiatives like this because it's not just us who has ideas, it's doctors, it's nurses, it's physiotherapists, it's receptionists.
We got into the business of being doctors so that we can help people and change lives, and this is an opportunity for us to make a massive difference to many, many, many lives.
And I have to say that our colleagues at where we work have given up their own time to help and support us as well.
And so I guess it's a question about how do we get the most effective solution to that that doesn't involve colossal duplications of effort.
I think it's really encouraging that the NHS is looking to inspire a new generation of future doctors to be more innovative and to develop things that are going to help patients more. And it's been really great having the input from the innovation expert to help me develop this idea, and it's forced me to really condense the things I was thinking into a business case and a presentation and something that I can actually action. So it's helped me realise this idea, or get a step closer to realising it. Anyway, all the people who have got through to this stage and some of the people who didn't as well are going to get the support of the NICE Hub. So I think there's multiple projects that are going to be developed as a result of this, each of which will hopefully have its own impact for patients. So some of them are things like mobile apps and new technologies, and some of them, such as mine, are much broader, looking at improving healthcare systems and people's careers in general. So hopefully hundreds, if not thousands, of people will benefit from the advice that I'll be able to give through my innovation.
The only slight negative, I would say, is that this is such a big task to get it right.
It's a bit unnerving, really. I couldn't tell what they were thinking, I think. As I was walking out, I could hear one of them saying, "Oh, it's too broad. I think I'm trying to cover too much." So that's all I know about what they're thinking.
My name is Rachel Clark, and thank you very much for inviting me here this afternoon.
It's, I think, a wonderful stance that you're taking, that you bring this to life by patient stories and by good and bad experiences, I hope, that you share of what it's actually like for someone to go through this emotionally, physically. And I just think, thank you, is my comment.
Well, thank you also. I mean, I'm delighted to hear that, because I didn't know I was talking to a patient in this audience.
Third place is Sam Falker for his novel Shunt.
So the second place, these are tough envelopes, is for the How To app by Dr. Asley Kelly.
The winner tonight, the novel drug delivery, Dr. Angus Goodson and Rihanna Firth.
And it's probably not that important which project actually wins, though I'm sure they're all excellent. But it's just to get the idea that you can, at an early stage in your training, in your career, have an idea that will make a difference. And we have to remember that there are other professional groups that we train, the nurses, the physios, the healthcare scientists, who will also have some good ideas.
In terms of would I do it again, the answer is a resounding yes. I mean, it has been tricky at times, but I must say the support that we've received from the Thames Valley and Wessex Leadership Academy and the other organisations involved has been outstanding.
It's really interesting. I've asked myself several times, would I do this again if I knew then what I know now? And I think the answer really emphatically is yes. It's not been easy taking this idea forwards, and there have been times when I've seriously questioned whether or not, is this the right thing to do? Is it the right time to do this now? But actually, reassuringly, every time I have those doubts, I come back with a resounding yes. We need to be constantly looking at ways we can improve things for our patients.